The Nebraska Trucking Association loves our first responders. And you guys are in a high stakes game when it comes to, especially as paramedics, where you are actually hands-on encountering patients. For you, disinfecting an ambulance could be a life or death question.
And it's important because if you don't take the time to do something small, it has an opportunity to have a major impact. And for the line of work that we're in, infecting a whole station isn't an option because then it could potentially affect response times because now you have to incorporate different areas. So just being mindful to pay attention to everything that you do.
One thing you want to note when you're dealing with disinfectant or bleach solutions is that it's actually a germicidal bleach. Sometimes we have household bleach cleaners that we use for laundry that may be color safe, that may not have the disinfecting qualities of a germicidal bleach. So just make sure you have the right bleach. And every bleach solution does have like a manufacturer's date on it so that you know that it's not too old, because it may not have the same type of disinfecting qualities if the bleach has been sitting around for, say, years. So just something that you might want to know. Well, you want to make sure that you're opening all doors and windows on the vehicle, that you have someone who is COVID positive that have been on the inside. What that does is allow it to be aired out and ventilated out. You have bleach solutions that you can use to spray down the outside of the truck or the vehicle. You can also just take regular soap and water and actually clean it and give it a nice bath, and that would be fine to kind of disinfect your exterior. So like if you have anything that's heavily soiled, we always suggest that you clean it first before disinfecting it. So if you're trying to sanitize anything, so say the person who is COVID positive touched the door to get in, but your truck is covered in dirt and grime, clean your truck, give it a nice car wash, and then sanitize everything off. When you're sanitizing, you want to remember to saturate the surface. The surface needs to be wet, and you want to leave it on for at least 1 minute before wiping it off to allow you time to allow the solution time to actually kill and disinfect. So I have gloves here too. So you want to always make sure before sanitizing any surface that you're protecting yourself. PPE such as gloves, you can even get gowns to cover up your actual clothing, because once you clean, you're going to want to take the clothes that you clean the surfaces off that you were wearing at that time. You want to take those off in laundry because you don't want to contaminate yourself or expose yourself later. So also you want to put your gloves on. There's safety goggles you can wear. Like I have a pair of goggles here, and it doesn't really, the type of safety goggle that you use is really not that important. Like you have a cheap pack of 3, and I have this set here. So put your goggles on, and if your goggles are like mine, can you hear me okay? And if your goggles, are like mine have like a suction to them, which doesn't allow any liquid or anything to get beyond the barrier. But you do not have to have those types. The type like you're wearing is completely okay. So want to make sure you have on a mask, goggles, and gloves at minimum. So when you're pre-mixing your solution, you want it to be between 5 and 6% bleach solution. So these water bottles here are 32 ounces or 1 quart. So for every 1 quart, you want at least 4 tablespoons of bleach, or 4 to 5. So you say about a 1/3 cup if you're using like a measuring cup. So you fill it to the 1/3 cup of bleach, and then fill it up to the 32 ounce line of water. So a 1/3 cup, 32 ounces. If you use towels that are reusable, that's completely fine. You just have to launder them on the hottest setting when you wash them. And I would disinfect whatever washing machine that you use to wash them or sanitize them after you're done with that load. So I would run like bleach and soap with nothing in the tank. Where if you have like, sometimes they have the refresh laundry disinfectant cubes that you can throw in. You can do that as well. Paper towels are also effective. I like the disinfectant wipes personally because you don't have to worry about things like when you're spraying, creating an aerosol and actually allowing those contaminants to be airborne. So you can just wipe down the surface, it stays wet. But we'll work with the bleach as well. Recommend saturating whatever towel or item that you're using again so that you limit the amount of contaminants in the air that could be produced by spraying it. But if you have goggles and a mask on, you can spray the surfaces as well. So you want to start with your most commonly touched items. So you want to do door handles, any knob of common use. So if you're in a vehicle, you like the radio, the steering wheel, the turn signals, your gear shift. You want to make sure that you're doing every item that somebody may touch commonly or use very frequently within the apparatus. I usually just decon everything that you would have to touch. So you have to think, with COVID, was the person coughing? Did they sneeze? Were they talking while they were in it? Because we know that it's spread through respiratory droplets. So when you talk or laugh or anything like that, you actually release particles. And so I would try to just cover as many surfaces as you can visibly. And if you want to be more thorough when you clean and make sure that you're sanitizing, you can do the preliminary wiping down of everything to try to take away most of the contaminants that could potentially be on the surface, and then go back through and spray everything and allow it to sit for the minute. You want to go back through after you wipe everything down, spray it for a minute, and then you can come through like with your regular towel and then wipe everything to kind of sanitize it out. And when you're doing it, these windows would be rolled down so that there's not a buildup of whatever the solution that you're using, because a lot of them have scents that may be toxic to you to inhale, especially when it comes to disinfectant. But we know that bleach is not really that big of a deal unless you mix it with ammonia, then you have a problem, right? So you want to make sure that it's a product that you're using that's appropriate for that particular fabric. So it's a cloth sheet, you may not necessarily want to spray bleach on it. There are solutions that you can put on there that will disinfect, like you can do like a Lysol spray or something else. And even with Lysol, if you look at the back and actually read the directions, it tells you that you spray it so that the surface is kind of moist. But if it's something you're going to sit in right away, I wouldn't necessarily.
So that's semi-moist touch.
Yes.
So again, a good application of the aerosol.
Right. You want to make sure that when you're cleaning any apparatus, you do it before you start and then once you finish. You put the windows down to actually clean, disinfect, give it the ventilation, but you still want to wipe those surfaces down once you're done with everything. And we understand that when you're cleaning, there's nooks and crannies and everything like that. That's why I said, wipe your surfaces, come back, spray your surfaces, saturate them for the minute, then wipe it down again to make sure you're thoroughly clean.
You want to limit the amount of like the air AC that is on. That's why you're opening the doors as well. Because if it is COVID contaminants in the container, it will actually spread.
So we should turn this on.
Yes.
Good, okay. So I pre-moistened another towelette. I'll continue wiping the buttons. parking brake buttons, toggle switches, radio buttons,
Rollo, do you clean this well at home?
I do not do any cleaning at home. Okay, so I'll moisten up another.
Once he does that, I will talk. Like, even in here, I noticed that there are surfaces that are easily mopped. I would also understand that particles fall due to gravity, right? So you would need to mop the floor, sweep it out before you mop it, and then clean the surface.
So the steering wheel is one of the items that gets touched the most. I'm gonna be extra thorough to kind of wipe this one down. Okay, got my turn signal lever. Got additional toggle switches. Get another grab. All right, I think we've got the dashboard area and controls pretty well wiped down. Oh, maybe the horn here.
Really? That was necessary?
This time it was. Okay, I have not done the fabric on the seat yet, seat belts.
But it'd be exactly the same on the other
That's
side.
exactly the same as the other side. Okay. So we've done the interior cab portion. Maybe I haven't done this panel. Yes.
Any surface that you could see visibly needs to be clean. So if you're using pre-moistened towelettes, as you wipe the surface and you notice that it doesn't get wet, you need to switch and get another.
Okay.
So today we kind of worked from area of high contamination to least. We might want to work in reverse, like least contaminated to the most, so that you're not spreading it across the gap.
While you guys are in there too, this being a new truck, it doesn't have CB in it yet, doesn't have the ELD in it, doesn't have any other electronic devices that go in. You might talk about cleaning those and being aware of different ways of cleaning some of those electronic surfaces and touch surfaces and things like that.
Well, even with like your CBs, you're using them and you're compressing the transmitter to talk. You have to be mindful that you're cleaning it, and each electronic device will have a specific type of cleaner that may be appropriate for that particular device. So you have to be mindful of that as well. So it's really important to know your material within your bin and what can and cannot be put on it.
One of the things about over-the-road trucking too is, the drivers are in and out of a lot of different places, depending on what kind of route they're driving, depending on what kind of freight they're hauling. So they may be in a factory at the beginning of the day and be in a warehouse or at a store at the end of the day. Who knows? What do you think they should keep in mind as they're going through their day in terms of how often should they be wiping the surfaces down, just in the course of work, not necessarily? Yeah.
So be mindful that the number one way to reduce transmission of COVID-19 is through appropriate personal hygiene. So hand washing for at least 20 seconds, hand sanitizers if they're in and out a lot, which will help kind of reduce the amount of contaminant that they may bring inside with them. Just being mindful of their environment and where they're going every day. Like if you touch different surfaces as you go into different businesses, to make sure you're washing your hands or making sure you're not bringing it back.
The other interesting part about a truck, of course, obviously very different from an ambulance, is this can be the guy's home for a number of days. So he's got his clothing, he's got his food, he's got a refrigerator, a microwave, she'll have bedding, she'll have a mattress back there. You know, what would you, if you were in their shoes, how often would you do things like laundry, knowing that all of that is within this very, very enclosed space?
I would do it daily, you know what I mean? Because here's the thing, I'm gonna take this out of you because I can hear myself.
Okay, that's fine.
Anything that you can do to create a barrier between where you sleep and where you ride to limit the amount of contaminants that could potentially be transferred from one place to the next is very ideal. So like even on our medic units, we have some with openings, kind of similar to this, not as large, right? And we may have a COVID positive patient in the back. Well, we separate that out and actually seal it off so that it doesn't carry over into the front compartment to keep the driver safe, but you still have to, again, disinfect and sanitize, but it will limit the amount of things that are transferred over to your clean.
Okay.
Also making sure that you're just doing, when you get in bed, that you're not getting in bed in the clothes that you've driven around.
Sure.
To shower before you lay down. Do everything that you can to limit the amount of things that are on your person before you lay down in the space that you want to sleep in. That makes sense. Doing everything to kind of keep their food in like food storage containers that before you open them, make sure you wipe the outer surface and then open it. Hopefully what you're wiping it with is food safe and not getting contaminating your food. But you wipe it, if you have a place to wash your hands, then get whatever item is inside to kind of limit you transferring what was ever on that surface into your hand.
What are you all being told from a professional's perspective about masks? Because there's still an ongoing thing about wearing a mask or not. We have been at the Trucking Association providing masks to drivers as best we can as the supplies are available. Heart to heart, should we be telling drivers to wear a mask whenever you're in or out of the truck?
If they're in the truck by themselves, they don't necessarily need to be wearing a mask. However, if they're exhibiting any type of symptoms like fever, headache, the normal COVID type symptoms, wear a mask to kind of limit how much particles or contaminants you are expelling onto surfaces while you're driving. We strongly encourage people to wear masks when they're out in the public, when they're exchanging information with other people, when they're going in and out of businesses, because the masks aren't really necessarily to protect us, it's to protect the other person. What we're finding is that if I'm a COVID carrier and I'm positive, and you have a mask on and you're not, but I'm not wearing a mask, we have a higher probability of getting COVID because I'm not limiting the amount of contaminants that are being released. So the mask is really truly to keep the next person safe. That makes sense? And it's double the safety factor goes up if the other person is also safe.
Earl, back to you. Back to cleaning.
You got us right. Okay, so we've kind of concentrated most of our efforts in the cab, the front portion. How about, since Kent was mentioning the drivers do spend a lot of time in the sleeper area, can we head back there and kind of work on some of those areas? So I'll trade you spots here. Let me go this way, we'll come this way, and I'll bring my cleaning supplies. Okay, so if you were to guide me on this area of the truck, where should I start?
I always, when I clean, work from the top down.
So it's the top down.
Okay, so any details? Yes.
That somebody might have touched.
And you want to also get inside the surface. So again, the way he's cleaning now, this is just to pick up any potential contaminants. Like I said, I would suggest a second round of spraying everything down and then coming through and wiping. We usually try to disinfect and wipe things down by making like one solid pass as we're cleaning. So instead of going back, forth, because if there were contaminants on this surface and you're scrubbing it back and forth like that, you're just kind of dragging it back and forth.
So one motion.
Yes, one
Okay.
motion.
Okay.
And you want to leave the surface as saturated as possible.
Sure. Okay. So one motion.
You do this to get the initial contaminants off because you want to go back and spray the surface to truly disinfect and kill anything that would be within the surface. The thing that's really truly important to know with a bleach solution, that it only is good for 24 hours from the time that you make it. So what we do is generally make all of our bleach solutions right at the start of our shift at 0700 in the morning. So first thing in the morning, we make a bleach solution. So that way, the next morning, the next shift knows it's time to redo it and make a new solution.
So with this truck having a sleeper in it, it's got a large fabric surface. Should I spray the Lysol on it? So I won't on this one because it's got plastic, but normally if I did have an open mattress and it's a large fabric surface, I would spray this down. Right? Okay, and leave it semi-moist. Good. And I do have a secondary pump. So we do the same thing.
I would spray it first and make sure everything is decontaminated because you don't want to pull it down and contaminate it in the process. But generally, if it's closed up like that, the odds of a whole bunch of contaminants getting into that pump are very slim. So you want to just truly focus on the outer surfaces that are exposed.
Okay.
Because it's just like if there was a picture on the wall and there was a fire and you take that, and there's smoke and stuff. Once you take that picture off, that part that's behind the picture is still white. Really? Same type of concept. You're going from the top down, make sure you're mopping the floor because we don't necessarily think about our shoes and what we're tracking in on our feet. But those things can be transferred over, especially if you're laying in a bed and eventually you'll be laying down.
Okay. On this side of the truck, we have some additional controls. So same as the front, I would wipe all of the controls that may have been touched.
Let's recap a couple of things really quick. We talked a lot about the environment for the driver in the truck. We haven't talked much about the technicians that are here. I mean, the folks can't see. I don't want you to swing around and show us the shop in there. Some of the guys that are working, most everybody in our industry has seen what a shop looks like. We know the technicians are in there. Any thoughts, any advice you might think to give the technicians who are out in shops like that when it comes to a truck that's coming in? They don't know what's been in it necessarily. They don't know what kind of environment it's been through, what kind of exposure.
Just get in the habit of being mindful that there are viruses that are present. Make sure that if there's gloves available, put gloves on before touching any surfaces. Like I said, hand washing is huge. It carries over quite well as far as reducing your likelihood of becoming sick. If you're working in a truck, regardless of what, if it's known or unknown, to make sure that you're not really touching surfaces like in your face. Because, like even in here, it gets warm, you might want to wipe your forehead off if you're sweating. Just be mindful that you're just putting contaminants on your face. It could potentially get into your eyes, into, like your nose, mouth, and that's what you want to do.
Now, if, let's say for a technician, how much of the COVID exposure can there be just airborne left in the truck? In other words, if they're concerned somebody has been in the truck, maybe they're symptomatic, maybe they're not, maybe they know, maybe they don't. But I'm going to get in the truck and I've got to move it into the shop bay, I've got to work on it, but I don't need to do anything to super. do I need to worry about things, disinfectant treatment of the sleeper compartment, or can I just focus on the area where I'm going to be in the truck? Makes sense?
Yes, that's a good question. So it's important to open it up and ventilate it out.
Okay.
If there's any type of suspicion that COVID could possibly be within the vehicle or apparatus, open it up, let the windows down, let it air out a little bit before you ever get inside. There's, like, even the CDC tells, like, hospitals, wait a day before you go in and try to clean those surfaces because it can continue to live for maybe 24 hours, you know? So just being mindful, preparing themselves to be protected. Put on PPE, wear your mask, if you think there's anything within that PPE.
And we have had some members who have emailed into us and asked a question, and you just touched on it, where they had a driver who was out in the field. The driver tested positive, they took him out of service, but the truck is still there. How long do they need to let the truck sit? Open all the windows, let it sit, or how long before they should go in and even start the disinfecting process?
Well, we usually send someone out if they had a COVID positive patient right away to disinfect them. There are UV lights, not the ones that like got bugs or anything, but there are special UV lights that disinfect the things and we have one of those in our department, and we go out with the light, put it in, and let it do its work to disinfect. So there are options. There's also companies that specialize in fumigation. They have aerosols that can spray in the department of the apparatus to sanitize the.
Sure.
So I would say, as long as you're opening it up, you're putting on like PPE to protect yourself, you should be okay. And make sure that once you come out of that vehicle, that you're taking off whatever you were wearing when you went in.
Okay. Which is a good reason to wear some kind of complete cover, so that when you come out, you're not having to clothing, you're just completely covered. Okay. To do some recapping in the time that we have left, best solutions, best disinfectant materials. We talked about a bleach solution. Run back through those things quickly. Somebody do so.
Well, the EPA has a lot of food products that can disinfect with COVID. If you go to the CDC website, there's a list of particular disinfectants that you can use. You also need to be aware of your manufacturer's recommendation for products, because sometimes you can spray a product on it and it completely different color, whatever surface is there, or completely ruin the finish. And we don't want that. Like the bleach solutions is really easy to come by. It's very inexpensive. Lifestyle works.
Does it work? Okay, so something like this, as long as it's a disinfectant spray.
I really strongly encourage like the bleach solution. It's readily available.
Okay.
It's pretty inexpensive. A third cup to 32 ounces, or a third cup to a gallon. But understand that those only last for 24 hours.
Okay.
So 24 hours, you have to pour it out, you'll redo the solution.
Never knew the bleach expired.
Yeah, I didn't either.
Never knew that. Okay. Recommended PPE for cleaning?
We recommend like a gown, gloves, goggles, anything that's a mask, anything that's going to protect your mucous membranes for the most part. Like, definitely want to protect your hands from the solution. You want to also make sure that your gloves or whatever PPE you're using are compatible with solution that you're using to clean. Because a lot of them may erode the latex in the PPE if you use a glove or nitrile gloves. So you want to be mindful of what you're putting on as far as the cleaning solution. For that,
Okay. And you mentioned them too. I should have mentioned this too. These are fine. Okay.
they do have like bleach bleach wipes, and then some are like hospital grade bleach wipes. So you just have to make sure that they match the ones like any of the bleach.
Okay, but as long as it's a disinfectant wipe, you know, whether somebody is spraying on and wiping, whether somebody's dipping a sponge in a bleach solution, all of those techniques are fine. It's a matter of what works best for their environment.
And you have to make sure that you're saturating the surface. That is key, that it has to be wet. And you leave it wet for at least a minute.
Okay.
Because if it's not doing that. But if you wipe and it's dry, you
didn't get it.
get it.
Yeah.
So that's why I suggest like wiping it first to take off some of the contaminant and going back and spraying it down, wetting the surface, and then wiping.
Number one rule for drivers, personal hygiene.
Personal hygiene.
And number two rule is be aware of any symptoms you might have. Yes?
Yes, so we know that COVID comes with potentially, you can have fever, you may or may not have fever, headache, loss of taste or smell, you can get vomiting, diarrhea, a lot of the normal flu-like symptoms. Sometimes people say that they're very tired. I have people say that I have muscle aches. So it's a wide range of varying degrees. Obviously, a cough, difficulty breathing. If you feel like there may be a potential that you've been exposed to COVID or that you're displaying the symptoms, go to get tested. You got Test Nebraska if you're in Nebraska. There's other sites that allow you to test.